Arianna, thank you so much for stopping by. You just came off stage. You are one of the biggest voices, if not the biggest voice, for mental health and AI. And so I would just love to get your sense of what do you think is the key focus area for people going into 2025? They're stressed about work. They're probably stressed about AI too. What would be one really big thing that you want all of them to know?
Well, the biggest thing, Ali, and it's always great to be talking with you, is to realize that the hyper-personalization that AI makes possible means that we can actually help people more than ever to adopt healthier habits, which is going to be key both for their mental health and their physical health. We like to link both because the 5 daily behaviors that we work on at Thrive are instrumental for both. Sleep, foundational, food, movement, we don't even call it exercise, just people moving, stress management and connection. All essential. And we are seeing that these are essential not just for prevention, but also for optimize the management of disease. And as we know, we're having a mental health crisis. 130 million people are already sick with something. And in the past, we all thought, well, changing behaviors, adopting healthier habits is incredibly hard. And we now know through this science of behavior change economics, of what at Thrive we call micro steps, tiny, daily, incremental steps, that actually we can change behaviors. We can become more resilient. And today at Cisco, G2 Patel talked about digital resilience. But we also need to focus on human resilience. And paradoxically, we can use the latest technology, the latest AI innovations to make human beings more resilient, which of course will mean that we'll be more productive, healthier, and more able to deal with the revolution that AI is bringing technologically.
There's so much change going on in the world. It sounds like one of the key components that we should be building up is resilience, and that AI can help us get there. If you could just give us kind of one view. You've been talking about everyone having their own mental health coach, and I know that you've even spun up a new company to be focusing on that. And so if you could just give us maybe one vision of what that could look like, so that as we're going into 2025, we get a better sense of how our mental health will improve, and maybe that'll be kind of that last punch that we give everyone.
So yes, we spun up a new company called AI Health Coach together with the OpenAI Startup Fund to precisely what you said, Ali, give you a health coach in your pocket. So let's say Ali has an AI health coach in her pocket.
I want one.
You want one? You're getting a beta version.
I'm going to get early access.
Absolutely, early access. So we train the LLM on the latest science of behaviors, not on the whole of the web, so that there are no hallucinations and it's all science-based. We also train the LLM on everything about Ali, your biometric data, your medical data, your lab data, but also your preferences. Ali, what music do you like?
Broadway all day long.
Broadway all day long. Yeah. Any poem you love?
Ooh, I like Emily Dickinson.
Emily Dickinson. Yeah. Any particular Emily Dickinson? We get very, very specific.
Oh, I think it's the one about hope. I'm
the
almost
one about Hop and the bird,
yes,
etc.
Yes.
Great. Any foods you like, all down to the specific food that Ali likes. Let's say Ali likes fried chicken. You know, the coach doesn't judge you.
Good.
Remember, that's one of the most
features.
important ways to change behavior. So the coach isn't going to tell you, oh, Ali, no more fried chicken. Can you please have avocado instead? No. The coach tells you, Ali, do you think you can prepare your fried chicken with olive oil instead of canola oil or seed oil that we know is much less healthy? So we start you small. And little by little, you adopt healthier habits, When you're stressed, and we know Ali's stressed right now, we feed you the Hop line from an Emily Dickinson poem, or we feed you 60 seconds of a Broadway song you love, which interrupts the stress cycle and moves you from the sympathetic to the parasympathetic nervous system, out of the fight or flight response. The point is that we have an enormous amount of science, and AI can help us combine it with the ancient wisdom of what people love, what they resonate with, and therefore how we can help them adopt healthier habits gradually but steadily.
I love how much you are doing for the world. I love that you're helping everyone think through these micro steps. And I really hope that by the end of 2025, we will be a much healthier world. So thank you so much, Arianna, for stopping by. It's always a joy to talk to you, and I'm glad I got the opportunity again.
Thank you so much, Ali.